Nurses in the state are asking for limits to the number of patients they can see at once. The Massachusetts Nurses Association says healthcare sees a significant downfall when nurses have too many people to take care of. Monday, the state Supreme Judicial Court validated the issue as a viable question on this year's ballot. Our Cam Jandrow joins us live now with more. Cam.
Brittany, the MNA says on a busy day, nurses can be responsible for up to a dozen patients, and this has negative implications on the care they're able to give to these patients. They're hoping this ballot initiative is able to take the weight off of these nurses' shoulders.
Nurses across the state are asking for help when it comes to the number of patients they see.
It can be difficult to provide safe and excellent care that we like to provide. We became nurses because we like to take care of people, but we like to take good care of people.
You need to be able to have the time to sit with your patients. Sometimes it's just to hold their hands because you're scared.
Monday, the Massachusetts Supreme Judicial Court validates a ballot measure to limit the number of patients per nurse. Kate Norton is a spokeswoman for the committee to ensure safe patient care. She says the goal is to improve the quality of local health care.
When there are not enough nurses to care for the amount of patients there are universally negative things that happen. We're talking poor patient outcomes, medical errors, preventable readmissions and infections.
The Massachusetts Nurses Association reports around 77% of state nurses care for too many patients at once. Eileen Ricoeur is a critical care nurse in Worcester. She says having to care for a large amount of patients on a shift happens more times than not.
I would say at least 2 to 3 times a week. They're contacted. Can you come in? Can you come in? We're short 2 nurses. We have, this many surgeries. The ER's backed up.
Patient limits would vary based on where nurses are stationed and the severity of their cases. The MNA says Massachusetts currently has no laws limiting the number of assigned patients, and they're hoping to regulate those numbers and get their question on the November ballot.
After 20 years of advocating for patient safety, now's the time to bring it directly to the voters and have the voters weigh in on what they would like to see in their hospitals.
Now, the next step to get the question on the November ballot is to gain 10,000 signatures by the beginning of July.